Hi, my name's Serena. I'm a clinical pharmacist and I work at Wetmore Doctor's Surgery. My role in primary care is to mainly do three things. So it's to improve safety, so whether that be the safety of the prescribing or making sure we stay to the correct guidelines. The second thing is to try and save money. So obviously with the practice, we need to try and save money for us, but also for the NHS. So we're prescribing drugs which are going to be the most suitable, but obviously the least cost to the NHS. The third thing I do is to try and save the GPs a bit of time. So using my expert knowledge in medications to try and take the pressure off them so they can focus on doing the consultations and the diagnosing. So generally my day-to-day is doing medication reviews, which could be over the phone or face-to-face. I also respond to medication queries, so any queries about side effects or interactions with medications, all those queries come to me to look at. I also look at all the medication in terms of the letters, so if there's been changes in discharges, in the clinic letter, so anything that comes from hospital where there's changes, I look at those letters and I make sure everything matches and any changes are made, so obviously all the medical records are up to date. So I went to uni. I did a master's degree in pharmacy, so that's a 4-year course. Following that I did 1 year pre-registration, which all pharmacists have to do, which you work in a community pharmacy or a hospital or a GP surgery where you spend some time on the job learning, and then following that you do an exam. Once the exam's done, then you're a qualified pharmacist and you're on the register. So following that, I initially went into community pharmacy. So I worked in, a shop sort of environment, so, a Boots or a supermarket or an independent pharmacy, where I was a pharmacist there. Following that, I became a pharmacist manager, so I managed one of those shops, which entailed a few different things, looking more of like the managerial side of things. And then more recently, I've come into GP work, so now I'm a practice pharmacist at a GP. They're all very, very different, and I've been doing this current role for about 3 years. So the top 3 skills I think you need to be able to do my job well is you need to be a team player, so really, really good at teamwork. You're going to be working with lots and lots of multidisciplinary teams, whether that be nurses, doctors, lots of different people. So team play is a great one. You also need to have a lot of patience because people are going to ask you lots of difficult queries, and sometimes you may not know the answers or ask you difficult things. So yeah, patience is really, really great, especially when you're dealing with the general public. And finally, kindness, compassion, a bit of empathy. You really need that when you're dealing with different patients who are dealing with long-term medical conditions. The advice I would give to someone, a young person starting in primary care, would be to try and work hard at your A-levels, because when you get to university it's so much less intense. If you can do A-levels, you can do anything. Also try and say yes to any opportunity that's given to you, because there's plenty of jobs in the NHS, so if one doesn't suit you, there'll be lots of other jobs that you can try, and make sure you just get stuck in.